Good morning, good afternoon, everyone. We are just about to get started with our session today. We're going to allow for like 1 minute for all of participants to get connected, and then we will get started. Thank you. Okay, I think we're ready to get started. So welcome to our 10th engagement with external stakeholders session of the Inter-American Coalition for Regulatory Convergence in the Medical Technology Sector. I'd like to start with some housekeeping messages. So we are all aware that this session is going to be available only in English or Spanish as preferred by our speakers. The session, as customary, is being recorded and will be made available through the coalition's website for all the attendees and all coalition members and member companies and partners that might not attend the session today. All the microphones are closed just to prevent background noise. And as always, we would like this to be a very interactive session, for which we would appreciate if you could post your questions using the Q&A feature of the Zoom platform. And please feel free to post your questions either in English or Spanish, and we will make sure that we have them translated to our speakers as appropriate. And as you received also in the invitation to this session, you can see the agenda in here that we're really very honored to have Manuel Gerardo Flores from OECD. We will have Karen Daquino from Anvisa, Maria Teresa Zelaya from El Salvador, and sorry, this was not updated, but we will have Ana Patricia Pineda from FDA. Talking about regulatory convergence and reliance. And we're going to be closing this session with Marina Carvalho, who will be sharing on the latest engagement of the coalition with the World Trade Organization. So without further ado, I'd like to start by introducing Manuel Gerardo Flores. He is coordinator of the OECD program on regulatory policy for Latin America. His main function is to advise governments to promote the adoption of public policies, institutions, and tools to improve the quality of regulations using international good practices as a basis. He has supervised administrative simplification programs, adoption of ICT solutions to improve government services and interactions with the public, implementation of regulatory impact analysis, review of regulatory policy, regulatory sector reviews, and training in regulatory improvements in Argentina, Brazil, Chile, Colombia, Costa Rica, Ecuador, El Salvador, Mexico, the Dominican Republic, and Peru. He is the author and co-author of more than 20 OECD books, chapters, and reports on better regulation for Latin American countries, and he's manager in the OECD of the Ibero-American and Caribbean Network for Regulatory Improvement. Manuel, welcome. Thank you very much for joining us today, and the floor is yours.
Thank you, Sandra. I say hello to all the friends and colleagues connected today. I wish to thank the coalition for this kind invitation. Now I'm going to share my screen for my presentation.
Thank you.
Here we go. Now you should be able to see it.
We do. Thank you.
Thank you. So Sandra and Steve asked me to prepare this presentation, which is one that I believe it is quite relevant, and I presented in the last APEC session on GRPs, but I touch upon several aspects which I believe are key for the use of GRPs. I first should start by introducing the OECD for those who don't know it. We are an international organization based in, the headquarters are in Paris, but there are offices in Washington, Mexico City, Berlin, Tokyo, and there are a couple of small ones in one in Italy and one in Turkey. I am based in the office of Mexico City, but my supervisor and I depend on the Office of Paris. And the objective of my office and my team is to precisely promote the use of GRPs across Latin America. GRPs defined as good regulatory practices. We call them inside our OECD lingo is a OECD best practice principles and recommendations on regulatory policy, but globally they are known as GRPs. The OECD has as its main objective to support governments. We have 38 member countries, and our objective, and many other associated countries and partner countries. And our objective is to help these countries improve their policy making and delivery. Our logo is Better Policies for Better Lives. And so we are a community of practitioners. We are organized through committees, working parties, in which we gather all officials from the 38 member countries and associated countries, and we get them to talk to each other so they learn from each other. They learn what works, what doesn't, and they exchange experiences, lessons learned. And we, the OECD Secretariat, we are in charge of systematizing that information. We are in charge of analyzing that and putting those back in the table as recommendations, best practices, principles. And we do this for around more than 200 committees and working parties that we have in the OECD on all aspects of public policy, including better regulation, including competition, SMEs, whatever topic of public policy you think of, that's we are working on. So in this area, I'm going to try to do a little bit of a reflection as to the value of GRPs, the contribution of GRPs to formalization, because we in Latin America, we have a very big problem regarding the formal and the informal economy. So I'm prepared this little presentation saying how these GRPs can contribute to formalization and the global economy. And I decided to divide this presentation in 3 types of GRPs, what I call the basics, then the classics, and the frontier topics. I define the basic elements, the regulatory practice, the basic GRPs in 2 elements: administrative simplification and licensing and permitting. I divided these 2 in different topics because while administrative simplification helps businesses helps governments to reduce burdens for citizens and businesses, in Latin America, we have a very big problem in how many formalities, licenses, permits, we call in Latin America trámites, how we have an abundance of them. There's a license, there's a permit, there's authorization for anything and everything. And those are if used correctly, licensing and permitting can help deliver policy objectives. So how they contribute to formalization and the global economy? Well, if implemented correctly, they make easier the opening, running, and growing of a business. And they benefit entrepreneurial and SME profoundly in a disproportionate way. But I want to make an emphasize this element of implemented correctly. You see, we in the OECD, we gather information of all Latin American countries, and we present it in reports that are publicly available. There is one publication which is called Government at a Glance in Latin America. You can just Google that and you will get a publication. We produce that report every 3 years, and is a compendium of practices and statistics and data of how governments work and what kind of programs they have. Every 3 years, all Latin American countries report that they have a program on administrative simplification. There's always something going on which the government is implementing, trying to reduce burdens, trying to simplify licenses, permits, either by eliminating or the formality per se, or by reducing data requirements, by reducing periods of response times. There's always, every government in Latin America, every year has a program on administrative simplification. And yet, Latin America's complexity, relative complexity is quite high. So what's going on? Why aren't these policies working? And one reason, and as I said here in key aspects for successful implementation, is because we notice in the OECD that there's a lack of focus on how Latin American countries apply this strategy of administrative simplification and a strategy of good licensing and permitting. The idea is quite simple. We call it the Pareto rule. And this is something that we find as a regularity across not only Latin American countries, but across OECD countries, which is 20% of your licenses and permits generate 80% of the impact. Those countries that have managed to make a registry of formalities usually count them in the thousands. Mexico at some point reported having more than 1,500 licenses and permits at federal level. Brazil is, last time I checked, is something beyond 2,000 licenses and permits. And if you start counting subnational governments, that actually goes to the triple or quadruple of that figure. But then not all licenses and permits have the same impact. One affect business activity, and other ones are quite highly demanded by citizens. So these projects, these programs on administrative simplification should focus on those 20% of license and permits that generate 80% of the impact. And the efforts of the government, which has scarce resources in terms of time, personnel, financial, and human resources, should focus on those 20%. Because when you have a minister or a president saying, we are going to simplify all formalities, all the 1,500 we have, my saying is that when everything's important, nothing is important. So focusing on this Pareto rule, and this is the key element, and that's a tricky question, how you focus on that. Well, you should perform public consultation. You should measure the impact of those formalities through the standard cost model. You should look at how's the frequency of those. There are several methodologies out there that can help you identify that 20% of licenses. But another key aspect for a successful implementation is that it requires real commitment from political leaders to support the reform efforts and eliminate resistance. One, and that's what I cite so heavily, is because the offices of better regulation, these ministries, agencies which are in charge of implementing this GRP, administrative simplification, license and permitting, usually they don't have under their portfolio any formality or license of their own. They are usually scattered across other ministries and agencies. For instance, here, the coalition, you deal with the ministries of health, right? And the ministries of health usually are the ones with the most burdensome and complex formalities and licenses and authorization. The sanitary registry is a pain in the neck in almost all Latin American countries. And the Office of Better Regulation of the country, say, okay, please, Minister of Health, simplify your registry. And the Minister of Health turns around and says, whatever you say, mate, but we won't do it. So we require the support of the president, of the head of the government, to really go and say, I'm going to make a commitment and I'm going to make my ministers listen to the Office of Better Regulation so they can follow suit on those strategies of simplification. Sometimes The politicians just go out there and give great speeches. They are in the front page of newspapers, online, on Twitter, on LinkedIn, on TikTok, saying, we're going to simplify, but they don't follow up. And then this, because there's resistance across ministries, because ministries don't like simplification, because the simple reason is because it requires extra work for them. They prefer to keep doing the same thing again and again and again and again, because they are not paid to simplify. They are paid to process the license. You need an external force to do that, which are the Office of Better Regulation, but they need the support for doing that. And we know that the more complex licenses are, the more chances for corruption there is. So there's an incentive not to simplify or digitalize them. So real commitment is needed for that. And that's the reason why in Latin America, there's a lack of commitment. That's honest. That's the honest truth. You know, countries from Mexico to Chile, Argentina, Brazil, they are marred with a sea of licenses and permits, of authorizations that affect businesses, affect citizens. And the fact is that when there are licenses which are very complex, the ones that suffer the most are SMEs, because an SME owner usually needs to get away from his activities in the business to manage or submit information of the license themselves. So while the big company can hire lawyers, accountants, and the offices of managers, of consultants to deal with the bureaucracy, SME owners have to do it on their own. How does the OECD contribute to this implementation of these ERPs? Well, we have a couple of reports there, and you just have to go to Google and Google them, and you will be able to download them. And from next year on, we're going to have also OECD best practice principles in licensing and permitting. So watch this space. The other set of ERPs, I call them the classics. This includes ex-ante regulatory impact assessment, stakeholder engagement, or commonly known as consultation, and ex-post analysis. These are the ERPs that help governments what we call in the OECD regulate based on evidence. I'm sure many of you are here familiar with the famous RIA. RIA is a tool that obliges public officials to think critically as to the reason why is it that they are regulating, what's the problem, what can be the solution, why regulation is the best alternative there is on top of doing nothing, or compared to a public campaign, public informational campaign, or a tax, or a benefit, a subsidy. And this is based on the merits of cost-benefit analysis that many times can be even qualitative one. But the idea here is that in the RIA, the public official thinks critically as to what is it that they are doing. And having a public official doing that is a challenge. In Latin America, the countries that have an obligation to do RIA includes Mexico, includes Brazil, includes Colombia, Costa Rica, and recently Ecuador also issued a decree on that. And Chile also has an obligation of this, El Salvador, and they vary from being included in a law to being included in a presidential decree or similar. One fundamental element to that can help think critically about the need to regulate and how to regulate is evidence. And the best way to collect evidence is through stakeholder engagement, public consultation. I have always said that it is quite arrogant and pretentious to think that an official from his nice office understands how the world works. And from his desk, and I'm sure he has a master's degree or a PhD from top universities in Latin America and in the world, but that's not enough. You need to go out there and collect evidence. you cannot regulate from the desk. You need to go and engage and ask all the people that are affected by the problem, the public policy problem, or the ones that are going to be benefited, the ones who are going to implement it, and all sort of stakeholders in order to see whether your regulation is hitting the target, is really addressing a problem that there is, not the one that your minister or your boss or you think is a problem. You need to go and collect evidence, and stakeholder engagement is one of the most effective ways of doing this. An ex post analysis, as many of you know, is once the regulation has been there for a while, once it's been working, now we need to check whether it actually worked and address the problem that we thought it was there from the start. If we have a problem of child obesity, has the new law, has the new regulation worked? Has child obesity decreased over these last 5 years while this law has been working? An ex post analysis is supposed to answer that and then provide information as to whether we should continue with that regulation, with that policy, or change it. So how they contribute, these classic GRPs as I call them. Regulation based on evidence. Regulation that are fit for purpose. What is a regulation not based on evidence, not fit for purpose? You know, just occurrence of a political leader. You know, things that are come off the top of my head. Oh, I just been to the countryside of my nation. I just been and spoke with some peasants, and they told me that they have this problem with this plague. So we need to issue a decree to forbid the entry of wood from the neighborhood country, despite the fact that we have a free trade agreement, just because a bunch of people complain. No, that's not regulation based on evidence. Or just because there is a leader, a political leader that believes that that's the way that things should run because I am the leader and I know how things work. That's not regulation based on evidence. Regulation based on evidence are the ones who pursue a legitimate public policy objective because it has been demonstrated that there's a problem with enough evidence for the government to act. The one that generate more benefit than cost. RIA, ex-ante RIA and ex-post analysis is about that. It's about demonstrating that regulations are actually delivering more benefit than cost. And make no mistakes, all regulation, apart from the regulation that says, you know, the Ministry of Economy has changed office hours or has changed offices, or that there has a new appointment, or like in Peru, that they issue decrees and notifications saying that a specific official has now permit to travel abroad. Those are regulations that don't actually generate cost and are published in the National Gazette, but all the others generate cost. And if they generate cost, you should have benefits alongside them. And not only that, but benefits should outweigh by a lot the cost. Because the idea is that if you apply these rules, these tools correctly, they're going to generate more benefits than cost. And they're going to eliminate unnecessary burdens for citizens and businesses. There is an analogy that I like to employ about how these different tools, ERPs, work. Imagine that you have a pool, Olympic size, not one pool. Let's have 3 pools together, Olympic size, and it's full of water, and the water is murky because the water represents the stock of regulation out there. What is a stock of regulation? Just go there to your National Gazette, look at the past 10 years, and try to make an inventory of all the regulations that have been issued. That's your stock of regulations. Some countries have a registry that they try to have every law, every regulation set there. Other countries not, but your official Gazette has all of them. And as I said, you eliminate all those ones which are for internal purposes of the organization of the government. That's your stock. And that usually includes regulation of high quality or low quality. The high quality ones are the ones who are based on evidence. that generate more benefit than cost. And they are combined with the ones that are low quality, regulations that were just issued as a road to reflex or because of some political capricious leader. And the combination of that gives murky water. But not only that, you have a pipe this big in which more water is flowing out and is pouring into the pool. That is the regulation that is issued every day. And again, it's just a matter of you checking your National Gazette so you can see how much regulation is issued every day there. And we're talking only at national level, just imagine a subnational level. And so there's a constant flow of regulation. And again, that's murky water because it includes regulation of high quality and low quality. And it's pouring into the piscine, into the pool, and it's increasing the level. And what you have in there trying to swim in this murky water are citizen businesses and their own government, and they're being drowned of the water. So these GRPs, they help you on one side. Ex-ante RIA helps you reduce the flow of new regulations. It reduces the size of the pipe, so it's this big, now this small, and has a super filter that allows only very clear water to go out and pour into the pool. So you make sure that no more bad quality regulation goes into publication and goes into enforcement. But you also need another GRP, which is ex-post analysis, to try and reduce the water, drain the pool, and also apply a filter so the water that stays there becomes very clear. That's ex-post analysis. So you need both of them. What are key aspects for successful implementation? Well, the OECD measures the implementation of these tools in these 4 countries in Latin America: Mexico, Chile, Costa Rica, and Colombia. Because they are the 4 OECD countries. The latest report is from 21, sorry. And the next one is going to be published next year. And you will see how these countries fare compared to other OECD countries. And I let you look into that. You can write it down. It's called Regulatory Policy Outlook. If you go and Google that, you will find the report from 2021. And next year, there will be the one for the recent data. So what are key aspects for successful implementation of these tools? What we call enabling factors that allow for a successful implementation. And this includes having a legal basis, having an oversight body who promotes implementation and applies a sort of policy of naming and shaming, saying which ministries are doing a good job in this, applying these tools and which are not, and obviously capacities for across government officials to prepare these tools, because you need capacities, some technical knowledge, not too much, but some technical knowledge to apply these tools. But also requires real commitment from governments to implement. These classic GRPs, when the government adopts them, what it's really saying is, look, guys, to businesses and citizens of my country, from now on, I make a commitment to make the regulatory process as transparent as possible based on evidence. And you have my promise that it will no longer be a black box, but it will be a transparent process based on evidence in which you as a stakeholder can participate and we will hear your news. It's a political commitment. So you require political pressure, because if a country's a ministry doesn't do RIA, despite the fact that the law says they have, nothing happens. So it is the head of the government, it is the senior leadership that needs to say, look, we have to have real commitment to do this. And it happens in countries like Australia, Canada, the UK. How does the OECD contribute to this? We have what we call best practice principles. They are there in the screen. You can Google them, read them, and apply them if you work in a ministry, or demand that your ministry, your government should apply them. Finally, the frontier topics, as I call them. These are topics which are now at the edge of the knowledge that are actually currently being developed, and by the same token, they are not as taken into consideration because countries are still struggling with the basics, with the classics, but still need to address these frontier topics. And they are regulatory enforcement and inspections, agile regulatory governance, and international regulatory cooperation. Regulatory enforcement and inspection is a fundamental part of the regulatory cycle, because once you issue regulations, they do not automatically are enforced. Lawyers, Congress representatives, and public officials believe that once the regulation is published in the Gazette, all businesses and all citizens will automatically comply with that. Wrong. That's absolutely wrong. There should be a strategy, an active strategy to promote the enforcement and through including inspections. We can spend a whole day, actually 2 or 3 days discussing this, but by now, what I can say is that this is one of the most neglected parts, because road enforcement and inspections can actually see whether the rule which is published and is apparently working there actually is changing the behavior of citizens and businesses in order to address the public policy problem. And these areas that are in charge of enforcement and inspection rarely are taken into account. They are usually understaffed, under-resourced, and the information they gather about whether the technical regulation, whether the regulation in general is working or not, that data is usually not shared with other areas of government in order to decide whether the regulation is working or not. It's a mess. But that's why it needs to be addressed and it needs to be implemented. Agile regulatory governance is about what the OECD proposes with this tool is to leave behind the paradigm of regulate and forget and implement the paradigm of learn and adapt. Countries, ministries, governments usually issue the rule and they believe it's a perfect rule, or it can be improved, but once they publish it, they say, well, it's there, let's forget about it. And if we apply ex post analysis, we are lucky. No, the new Agile, it means that because all the technological advancements we are having in terms of data, in terms of other advancements in science, like biological technologies, international artificial intelligence, all this, it requires government to act more rapidly, quite fast, and try to measure, determine whether this represents risks to the population and act accordingly based on evidence which is being generated almost in real time. So what this is that the process of regulation needs to be agile in order to include all this new information and react quickly. Again, leave behind the paradigm of regulate and forget to the one of learn and adapt. And IRC, International Regulatory Cooperation, is about what we're doing right now. The global village. What one country does affects not only the neighbors, but affects the whole region and probably even the planet. So when countries regulate, they need to consider the international dimension, their partners, the trade partners, and other areas, which means collecting evidence at the international level and engaging with stakeholders at international level in order to regulate better. So they contribute to the formalization of the global economy by helping business to comply with rules and standards. You see, as I said, if you have the rule but nobody's complying with it, your rule is useless. I already mentioned about the innovation. We need to harness innovation and data. Harness innovation and data can make the framework more adaptable so business can take advantage of technology. So it works both ways. With technology, governments regulate more agile, but also with technology and data, governments can identify risk more rapidly, being agile. And I already mentioned about IRC. Key aspects for successful implementation of these GRPs include the intensive use of data. All of these GRPs require a lot of data. And if governments are bad at something, it's at collecting and processing data. Sometimes governments collect a lot of data, but they are in paper, not even digitalized. So nothing is being done with this data. So that's the real challenge. These require a lot of data, and governments are still not equipped for doing that. So there's need to be reform. A willingness to experiment and especially learn from mistakes. Latin American countries, especially their political leaders, they don't like to recognize that, we're learning, we're experimenting, we're making mistakes, and we will adapt and change as needed. No, governments in Latin America are perfect, and they never recognize a mistake. Whereas this is a different approach. This approach in which government says, look, this is quite new. Let's try and experiment and learn from that. If it doesn't work, we will adapt, we will change. And also, you need to engage with a wide range of stakeholders. From enforcement and inspection to Agile to IRC, this requires a large number of stakeholders, including businesses, citizens, business association, international partners, and governments should be willing to engage with all this. The OECD contributes to these GRPs. We have 2 recommendations that, again, if you Google them, you can find them and download them and read them, please. They're quite interesting. Recommendation of the Council on Agile Regulatory Governance and also in international cooperation. And we have a toolkit to implement best practices in regulatory enforcement and inspections. And with that, I finish my presentation almost exactly on time. Thank you, Sandra.
Thank you very much. That was really perfect time management. So, Manuel, really thank you. Thank you very much for sharing. And we have a couple of questions in our Q&A feature of the Zoom platform. The first one is from Roberta Melemasa. So she says, from your perspective experience, which is the best deregulation program in LATAM so far? Other countries could learn from?
Okay. I think all Latin American countries have very good initiatives that they can share with each other. First of all, I would like to mention that the word deregulation is no longer in use. We should abandon that because it conveys the wrong message. The same way in which we have abandoned words that are not politically correct, I would say that in this new era, the regulation is no longer politically correct because it means eliminating rules. And better regulation, regulatory policy is about eliminating those who are not complying with policy objectives and regulating where there's a need for that based on evidence. But again, everything is based on evidence. The regulation has the idea of, let's not protect the environment anymore. Let's not protect workers or consumers anymore. And let's just eliminate rules because in that way we benefit businesses. No. Let's eliminate the regulation. Now, having said that, there are very good initiatives across Latin America which are worth looking at. Not many years ago, Mexico made this a implementation of the standard cost model, in which through a series of techniques, methodologies, including collecting data from businesses and citizens, they were able to measure the burden of all the economy, of what licenses and permits generate for all the economy, and then apply measures to reduce that. The Dominican Republic also follow that. It is called Burocracia Cero. You can Google that and you will find some good information. Now, other countries like Costa Rica has a digital investment window in which they help businesses set up an international level and also a subnational level. There are several of these ones. And Brazil, as we know, the regulators, the economic independent regulators are a sea of good practices. So we can spend a lot of time working in identifying this, but in a nutshell, one single example that stand out is not there. At international level, during the 90s, Australia did a tremendous effort to simplify and eliminate rules that affected competition, and that basically triggered the high level of competitiveness that now Australia has. So if you Google Australia, deregulation in the 90s, Australia, regulatory reform in the 90s, you will find that story.
Thank you very much. We have another question. This is coming from Natalie Trejos. Good morning. Regarding the application of the Pareto rule to help regulators focus on the 20% of processes that have 80% of the impact, you mentioned that various methodologies can be applied, for example, metrics. But just as you mentioned, many regulators in the region do not track or publish such metrics. The industry, on the other hand, maintains market metrics, but these are not publicly available. You also referred to public consultations, but these are typically used for regulatory changes, which might make their application in this context more complex. Could you please elaborate on these methodologies to implement the Pareto rule and suggest ways to train and support regulators in implementing them or prioritization alternatives?
Sure. Well, first of all, the first idea that I want to convey is that this shouldn't be regarded as rocket science. Better regulation should be seen as a pragmatic policy, you see, which follows a lot of intuition and a lot of engagement. And this is the key word, engagement. One way to approach this Pareto rule is usually governments have internally this information, they do have it. And those who say, no, we don't have it, probably they're lying. You have information on the frequency of licenses and permits. Usually governments know this year, 125 businesses applied for this license, compared to last year, who was only 95. And compared to this other license, in which we actually have 1,500 companies submitting this license. That's called frequency, and others call it population. The population of businesses and citizens that apply or submit a license. That's data that can help you identify your Pareto. Because what happens? Usually when you have this order by the political master saying, you need to simplify all 1,000 formalities that you are there, and then the Office of Better Regulation looks at 1,000, but then they look, okay, let's start with something easy. Let's start with the authorization to rent the basketball court to hold a public ceremony. Those are very simple formalities, that can be easily simplified. And, I already simplified that. How many people apply to that license a year? 5 people. Doesn't have an impact. Mm-hmm. So looking at frequency can help you determine your Pareto. Another one is speaking with stakeholders. Not getting metrics out of them, but speaking. Meet with business associations. Make sure that you include SMEs. Meet with consumer associations, meet with the non-for-profit sector. Engage, go out there and collect, including you can run a simple survey on businesses and send an email and ask people to fill the survey. You can go and look at economic data from your census, from economic census, and see whether make a match. Usually you have a list of formalities from each ministry, and you can see, for instance, what is the contribution of GDP to the tourist sector, and you can prioritize that. So you can make use several methodologies to identify your Pareto, but the idea is go there and ask and collect data.
Manuel, thank you very much. We have a couple of questions that, if you don't mind, we would be emailing those to you just to follow on the time established in our agenda. We're really, really very appreciative, and we're expecting this to be the first, but by no means the last time we have you joining the coalition members. You'll see we're all eager to continue learning and to continue supporting regulatory authorities in the region as to promote better regulations in order to improve access to health technologies to patients in the region and, of course, in the globe. Manuel, thank you very much again. Have a great rest of your day.
A pleasure. Thank you for the invitation. Bye now.
Thank you very much. So now continuing with our program, we are gonna have our next session on convergence and reliance, including tools to facilitate implementation. And for that, I am really very honored to present Karen Dakinonovs from Anvisa, Maria Teresa Zelaya from El Salvador, I'm sorry with my nomenclature, SRS, and Ana Patricia Pineda from the USFDA. And I will start by introducing them, and then we will continue with their presentations. So Karen is General Manager of the Medical Devices General Office at Anvisa. She's a chemical engineer and has a postgraduate diploma in industrial management. She's an expert in health regulation and surveillance, and she has been International Medical Device Manufacturing Inspection Officer. She has been a member of the COVID-19 Crisis Office representing Anvisa and the Chief of Staff of the Presidency of the Republic. She has also been an advisor to the General Management of Medicines and manager in the area of import licenses and products subject to sanitary surveillance. And she has also been a coordinator of inspection in bioequivalence centers. So, Karen, thank you very much for being here with us today. I'll continue introducing Maria Teresa Zelaya from the Superintendency of Sanitary Regulation in El Salvador. She is graduated in chemistry and pharmacy from the University of El Salvador. She has a master's degree in project administration from the International Ibero-American University of Mexico. She's a professional with more than 10 years of experience in the field of health regulation, and she has held several positions within the National Directorate of Medicines. Among them are health registry reviewer, chemical supervisor of health registration and medicines, head of the medicines registration unit, and currently she's superintendent of records and registrations of the Superintendency of Health Regulation. And last but not least, Ana Patricia Pineda. She joined the FDA Mexico on March 2013, where she has collaborated on the medical products portfolio of the Latin America office. She has a Bachelor on Sciences on Chemistry, Pharmacology, and Biology from the Universidad Nacional Autónoma de México, and a Master on Science degree on Toxicology from the Centro de Investigación y Estudios Avanzados of the IPN. She started her professional career in the pharmaceutical industry in the production area. In 2001, she joined the Mexican government as head of the toxicology department of the Environmental Health General Directorate under the Ministry of Health of Mexico, participating in the development of the risk assessment area. For 10 years, Ms. Pineda was manager of international affairs on drugs at the Federal Commission for the Protection from Sanitary Risks, COFEPRIS, where she coordinated COFEPRIS participation and represented this regulatory authority in international fora regarding drugs, medical devices, dietary supplements, cosmetics, toxic substances, and pesticides, such as Asia-Pacific Economic Cooperation, APEC, the WHO, World Health Assembly, the Pan-American Network for Drug Regulation Harmonization, the International Pharmaceutical Regulators Forum, the Global Health Task Force, the U.S., Mexico, and Canada Trilateral Cooperation, the United States Environment Program, among others. Ms. Pineda also represented APEC as a regional harmonization initiative at the International Conference of Harmonization. So with this very impressive curricula from our three lady panelists, presenters, speakers today, I'll open the floor for Karen to start sharing on Anvisa's experience on convergence and reliance. Thank you very much for joining us today.
Okay, hello. Thank you. First of all, thank you for the invitation to participate of this session and for the opportunity of sharing the challenges that Anvisa is facing to implement the reliance. Sandra, I prepare a very short presentation. If I could share. Let me check how I can do this.
In the bottom part of the screen, you can see the share button
Share.
in green. It is coming.
Can you see this?
Yes, we can see. We cannot see it in presentation mode. Okay, now we see. Thank you.
Okay. Let's start. Okay. Oops. Okay. Is all right now?
It is working perfectly.
Okay. Okay. So I started in Anvisa since 2001, and specifically in the General Office of Medical Devices, the pre-authorization, about 4 months. So aligning with the work of regulatory harmonization and convergence, in 2022, Anvisa published the General Resolution for establishing the rules for admissibility of analysis carried out by other regulatory authorities. And in June of this year, we published the resolution 290 that brought the reliance practice to non-IVD and IVD medical devices for pre-market authorization. And the product registration certificated from equivalent foreign regulatory authorities. Now can be used for abbreviated analysis. So initially, we defined these authorities that we will work with, the same of the MGCEP founding members. What means Australia, Canada, TGA from Australia, Health Canada from Canada, US FDA, and Japan. We accept for reliance on Class 3 and Class 4 medical devices, as defined in our resolution. And for this, the product must be essentially identical. What means the documentation that proves the registration or authorization issued by the authority equivalence must refer to a medical device essentially identical to the one intended to be registered with Anvisa, and must include information regarding the indications of use, intended use, and manufacturers. And what we ask and we establish in this resolution. So to enable this assessment, this reliance and PETS way, it requires that the companies submit the following documentation in addition to the registration ordinary process. So they have to send it for the reliance assessment, proof of approval in the reference NRA, the original instructions for use presented and approved in the reference NRA, a declaration by the manufacturer regarding the equivalence of the products and the absence of circulation restrictions due to safety and performance issues, and some specific requirements for labeling. Difference between products that are considered essentially identical cannot impact the performance or the quality of the products. A common example of this is changing the power plug of equipment, since the standard is different between the countries. Some specific requests for the labeling, we can talk about the information showed in label and instruction of use must be in Portuguese. The medical devices that are subject of compulsory certification must meet the requirements of specific regulations. And just to remember that Anvisa may choose at any time to carry out the full assessment or technical dossier, or may ask for clarification on the documents submitted for analysis. And Sandra, you think I can talk about this challenge?
Oh, yes, please.
May I continue now, or would you like
yes,
to
yes.
ask some questions, some clarification about the
I think if it is okay with you, we can continue. And
Mhm.
At the end of all the three presentations, we will be consolidating the questions that we are capturing in the Q&A tool. Thank you, Karen.
Okay, so I talk about the procedures that we are using so far since the IN 290 that we accepted the Reliance documentation. During these months, we identified some challenges and some points that we are working in during this time, and I would like to share with you. And the first one is difficult in identifying the models and components of the equipment family in the register. We did not find a description of the equipment models and all the modules. In this case, we had to analyze in the ordinary path. We have difficulty in the proof of registration or authorization issued by equivalent foreign regulatory authority that not apostolated in the country of origin. The GMP certificate does not cover the product risk class. Example, they have only in the GMP, it's only for class 3, and the company send the Reliance for class 4. And we did not find all the components, for example, in the system, in the product that is composed by several components. We can't find all these components in the CLC issued by the country. And so how can official medical device databases contribute to Reliance? How can the authorities and manufacturers access databases? So there is currently no standardization in the type of information disclosed in the databases. This makes it difficult to identify products registered in different countries. I think this is the challenge that we are facing now. And since we start since June, so it's not a long time, it's a short time. And just to remember that since we started with the Reliance PET, we received 140 submissions based on Reliance. Most of them are classified as materials and based on products already approved by US FDA. And from of these 140 submissions, we have reviewed 37 petitions, and the rest are waiting to be evaluated. And I think is this information so far. Okay, thank you, Sandra.
Thank you very much, Karen. And as I mentioned before, we will wait for our participants to pose their questions in the Q&A feature of the Zoom platform. And then we will continue with Maria Teresa Zelaya. Thank you very much. If you can stop sharing your screen.
Let me... Stop it? No.
Muchas gracias. Antes que nada, pues agradecer por el espacio. Creo que son importantes para poder dar a conocer nuestra misión y el trabajo que estamos realizando. El licenciado García se disculpa por no poderles acompañar en esta importante actividad, pero con mucho gusto, pues vamos a hablar un poco sobre lo que está realizando la Superintendencia de Regulación Sanitaria de El Salvador en cuanto a convergencia regulatoria y reliance. Quiero decirle que personalmente es un tema que me apasiona mucho y además que impacta de una manera que todavía no hemos encontrado quizás todas las autoridades ese valor que tiene el lograr aplicar reliance y por supuesto lograr la convergencia regulatoria entre los países. Como convergencia y reliance, yo no puedo reconocer algo que no conozco. Primero que nada, quiero presentarnos y explicarles quiénes somos como regulación, como Superintendencia de Regulación Sanitaria. Recientemente nos hemos transformado, éramos Dirección Nacional de Medicamentos y ahora somos SRS. Y lo que se ha hecho es ampliar nuestro horizonte o nuestro marco de aplicación y ahora tenemos productos como alimentos y bebidas, tabaco y alcohol. La intención es poder regular todos aquellos productos que impactan pues la salud pública. En ese sentido, pues ya tenemos los dispositivos médicos, los medicamentos para uso humano, uso veterinario, productos químicos, cosméticos, higiénicos para uso humano y veterinario, y también bebidas, tabaco, alcohol y pues obviamente los alimentos. Y todos, además, todos los establecimientos que regulan a estos productos, tanto su fabricación, su distribución, su venta, su almacenamiento, su importación, etcétera. Entonces, eso somos como SRS. Nuestras proyecciones en atención a lo que la ley nos permite es, por supuesto, la cooperación interinstitucional, que va pues muy de la mano con esta convergencia regulatoria. El fortalecimiento de las capacidades, tanto internas como también de nuestros regulados, y es abajo como tenemos esa cooperación regulado-regulador, porque evidentemente si no hablamos el mismo lenguaje, se hará mucho más difícil la comunicación y por supuesto los procesos y proyectos que tenemos como institución y pues las gestiones administrativas. La vigilancia sanitaria, la agilización, simplificación, modernización, innovación de todas las funciones regulatorias que nosotros desarrollamos, garantizando la calidad, la seguridad, la eficacia de los productos y ahora también la inocuidad de los alimentos. Y está el componente de armonización normativa que pues tenemos potestad para emitir las normas y esto nos permite ir actualizando nuestra normativa en atención a las necesidades que se vayan identificando. Nuestra metodología de trabajo que ha permitido lograr muy buenos resultados con mucho trabajo, por supuesto, del equipo, se traduce en tres aspectos. Y en el primero, está relacionado, y por eso quería ponerlo y visibilizarlo, que el aspecto de reconocimiento es importantísimo para lograr la eficiencia de los recursos. Y es por eso que la forma en cómo nosotros pues trabajamos de forma eficiente es implementar los reconocimientos extranjeros cuando se tenga ese respaldo técnico y legal. En el caso de los medicamentos ha sido mucho más sencillo. Desde el 2013 teníamos normativa específica, que es un decreto ejecutivo que nos permite reconocer los registros de productos que vienen registrados de autoridades de alta vigilancia, incluyendo los productos biológicos y biotecnológicos, siempre y cuando se tenga normativa específica en el país de origen para registrar estos productos. Quiere decir que tenemos más o menos 11 años de venir puliendo, comprendiendo, madurando todo este proceso. Luego agregamos el componente de eliminación de barreras burocráticas. Tenemos una normativa nacional que nos obliga a hacer una revisión a detalle de requisitos que verdaderamente agreguen ese valor a la evaluación y no sea un mero requisito para llenar un espacio, sino un impacto a la autorización. Y por supuesto, como lo mencionaba en la lámina anterior, la capacitación a nuestros regulados sobre observaciones frecuentes para que podamos disminuir así la brecha de las observaciones y así evitar pues reprocesos, ¿verdad? Y eso se ha traducido en la agilización y la simplificación de trámites, logrando en unos casos, en muchos casos, tiempos de respuesta menores a 10 días. Ahora, sobre buenas prácticas regulatorias, afortunadamente hemos logrado construir desde la institución un cuerpo normativo que le da vida a la Superintendencia de Regulación Sanitaria y esto está basado en la herramienta de evaluación de la Organización Mundial de la Salud para poder abordar todos los aspectos regulatorios o todas nuestras funciones normativas y regulatorias, perdón, de una forma completa, sin dejar ningún cabo suelto, y así poder cumplir con la intención de que en todo el ciclo de vida del producto podamos estar presentes y aplicar la normativa que corresponda para poder garantizar la seguridad, la calidad, la eficacia de cada uno de los productos. Contamos también con potestad normativa, somos una institución autónoma que nos permite desarrollar normativas que vayan no solo a la vanguardia, sino que respondan esas necesidades de salud, tanto de pues quienes hacen las solicitudes de los trámites, como también de nosotros para poder hacer las evaluaciones de los mismos. Contamos con herramientas colaborativas innovadoras. No desarrollamos ningún tipo de sistema informático, sino se hace de forma conjunta entre el regulado y el regulador. Porque vamos a una transformación digital. Muchos de nuestros trámites están completamente automatizados. En algunos otros vamos poco a poco incorporándolo, no solamente por las limitantes tecnológicas o de personal, sino también porque construimos de una manera colaborativa estas herramientas. Contamos también con la información pública que nos permite poder informarle a nuestros regulados la información que deben presentar para la gestión de los trámites. Y así también que las autoridades reguladoras que nos conozcan pueden referirse a nuestras páginas web y poder identificar los cuerpos normativos para saber si están en coincidencia con su normativa y así poder reconocernos a nosotros también como nuestras decisiones regulatorias, ¿verdad? De forma parcial o de forma total, pero que podamos contribuir también a agilizar sus procesos regulatorios. Contamos con un plan de facilitación de comercio, el cual garantiza la libertad económica, pero también, y como un aspecto principal, la salud pública. En caso de llegar a identificar una situación donde estén estos en alguna contradicción, por supuesto, siempre es nuestra prioridad la salud pública. Y esto además nos permite visualizar una agenda regulatoria anual en la cual se incorporan aquellos aspectos normativos que deben de ser generados, modificados, actualizados, para así poder responder a estas necesidades que van cada día, ¿verdad?, a la vanguardia, y eso nos permite poder responder de forma inmediata a estas necesidades. Así, esta creación de cuerpos normativos está bajo un mecanismo de consulta pública tanto para el sector nacional como para el sector internacional, y esto permite tener las reglas claras y conocer en esta consulta pública todas las opiniones o conceptos que pueden reevaluarse o valorarse para incorporar un cuerpo normativo que sea coherente a las necesidades y también al estándar y nivel técnico que están pues a nivel mundial. Ahora bien, para hablar de Reliance, me gustó mucho la imagen porque es justamente eso, una ruptura de un mito para pasar de donde estamos en un ambiente pues muy cerrado a un ambiente que nos permita ampliar también nuestras funciones regulatorias o enfocarnos en otras funciones regulatorias. Y esto es precisamente romper el mito porque no es una forma menor de supervisión regulatoria, al contrario, es una estrategia que permite hacer un mejor uso de aquellos recursos disponibles que tengamos. Las autoridades reguladoras enfrentamos muchas limitantes de recurso humano, de componentes que son fundamentales para poder desarrollar nuestras funciones. Desafortunadamente no contamos con un presupuesto totalmente abierto que nos permita hacer estos verdaderamente batallones que se necesitan para poder atender la demanda de solicitudes. Entonces, lo que nosotros hacemos es aplicar estas herramientas de Reliance tanto de forma parcial o total en nuestras propias decisiones regulatorias. Creo que es muy importante hacer conciencia sobre que no quiere decir que perdemos la autonomía. Al contrario, tenemos información que nos permite ampliar nuestras decisiones y agilizarlos en la mayoría de los casos. Hemos trabajado mucho a lo interno para poder romper este mito principalmente en los evaluadores, en las jefaturas que puedan decir, apliquemos para este tipo de productos que tienen estas características o criterios, apliquemos reconocimiento y enfoquémonos a estos que no tienen o que no cumplen el criterio. Y así, con base a riesgo, podemos tener resultados muy positivos. Pero como por supuesto lo expresa la Organización Mundial de la Salud, hay principios básicos, entre ellos es contar con una base legal robusta que respalde esas decisiones regulatorias y es así como nosotros contamos con cuerpos normativos que permiten desarrollar lo que continúa un manual de aplicación de Reliance, en donde teniendo las reglas claras, los criterios de inclusión principalmente, pues podemos así tener la libertad de aplicar de acuerdo a cómo se realice el análisis esta ventaja, ¿verdad? Que es Reliance. Quiero decirles que entre una de las situaciones que se identifica es no dejar listas frías de autoridades que son de referencia, sino dejar criterios de inclusión o exclusión que permitan así ir ampliando esta lista de autoridades reguladoras. O, por ejemplo, podemos tener una autoridad reguladora para reconocer productos farmacéuticos, pero no tal vez dispositivos médicos. O sí dispositivos médicos, pero no ensayos clínicos. Entonces, lo más importante es tener esos criterios que de acuerdo a la función reguladora, pues podamos incorporar. Y el componente más importante, porque nosotros de verdad desarrollamos muchísimo la buena fe y confiamos en nuestro regulado, pero tenemos que desarrollar y verificar lo que hemos autorizado. Y por eso nuestro equipo de vigilancia sanitaria es fundamental para poder continuar pues con confianza regulatoria. Por eso realizamos un proceso de vigilancia en atención a riesgos. ¿Quiénes hemos aplicado Reliance? De forma general, pues a muchas de las funciones, a todas las funciones regulatorias que tenemos. No obstante, sí quiero hacer ver dispositivos médicos que nos ha permitido tener una disminución de tiempos de un porcentaje considerable. En pandemia tuvimos que avanzar un poco más con el tema de dispositivos médicos. En el caso de productos farmacéuticos es uno de los que está más desarrollado porque, como les mencionaba, tenemos 11 años con un cuerpo normativo que nos ha permitido avanzar, madurar con esto y es así como tenemos un promedio de 10 a 14 días para poder dar respuesta a estas solicitudes que vienen pues con la información completa, porque la autoridad reguladora debe de conocer toda la información y también la autorización del país de origen y si este es de alta vigilancia y además podemos verificar la evaluación del mismo, pues nos permite avanzar de una forma más rápida. Además, se han hecho esfuerzos centroamericanos de reconocimiento mutuo porque tenemos una normativa armonizada centroamericana y pues es así como también cosméticos e higiénicos ha logrado un impacto importante. Razón por la cual tiene 5 días de respuesta para dar una autorización de reconocimiento mutuo centroamericano. Otras aplicaciones, como les mencionaba, en medicamentos, además buenas prácticas de manufactura, reportes públicos de evaluación. En el caso de ensayos clínicos, también estamos con las buenas prácticas de manufactura. Por supuesto que reconocemos a las normativas internacionales, así como en el aspecto de liberación de lotes, reconocemos los certificados de análisis, igual que hayan sido vacunas precalificadas por la Organización Mundial de la Salud, etcétera, ¿verdad? Nosotros no tenemos un laboratorio para desarrollar pues todas las pruebas necesarias para poder liberar una vacuna. Por eso es que si estos certificados son emitidos por una autoridad de alta vigilancia, pues procedemos a la liberación respectiva. Quiero hacer ver también el impacto positivo que ha tenido en los tiempos de respuesta. Este ha sido un mensaje que hemos repetido como superintendencia, el tiempo de respuesta, pero luego voy a hablar sobre no es solamente el tiempo, sino lo que le damos a la población. Estábamos más o menos en 30 días para poder emitir un registro y hemos estandarizado o hemos logrado establecer 13 días para la emisión de un registro sanitario, contando los tiempos de evaluación que corresponden a la superintendencia, porque está el tiempo adicional que tiene el regulado para poder dar respuesta a las observaciones emitidas o los procesos administrativos adicionales que corresponden al proceso. Nos ha permitido el disminuir o el enfocarnos en procesos de capacitación también. Haciendo eficiente el proceso, capacitamos al regulado y capacitamos a nuestro personal para que tenga también las herramientas o los conocimientos necesarios para poder avanzar mucho más rápido en bioequivalencia, en normas diferentes, ¿verdad? Que son de aplicación mundial, normativas ICH, farmacopeas, también en inspecciones, en manufactura, en vacunas, etcétera. Esto porque si no se tiene tiempo para poder capacitar al personal, entonces se tiene un personal que está listo para correr una maratón, pero que no tiene el entrenamiento necesario para poder ganar ese maratón. Entonces esto es como muy importante. Asimismo, hemos gestionado y generado con apoyos y también con medios propios intercambios en ensayos clínicos, en promoción y publicidad de los productos, en farmacovigilancia y por supuesto escuchar experiencias de nuestros homólogos que tienen también desarrollados los procesos de Reliance. Somos el hub de regulación regional para el control de calidad de dispositivos médicos. Eso nos permite también poder generar resultados para que nuestras autoridades reguladoras homólogas puedan referirse a nosotros en atención a la calidad de los productos o dispositivos médicos. Y esto fue también con el apoyo de la OPS en el 2023. Sobre inspecciones o vigilancia sanitaria, pues contamos con un plan de vigilancia que lo desarrolla la Superintendencia de Regulación Sanitaria en atención a todos lo que se ha ido recogiendo de las demás áreas para poder así lograr con el riesgo, con identificación de riesgos, atacar esa necesidad de identificar productos que puedan tener algún tipo de deficiencia en su calidad. Hacemos un monitoreo constante, de hecho hemos desarrollado una herramienta con inteligencia artificial para tomar todas las alertas sanitarias y así poder ir construyendo pues también nuestro plan de vigilancia. También con las denuncias tanto de los miembros del Sistema Nacional Integrado de Salud como de la población en general y así pues desarrollar vigilancia. Esto no hubiese sido posible si no disminuimos de alguna manera esa carga administrativa, voy a decir, o que no enfocamos el esfuerzo donde corresponda. ¿Y qué resultados hay para la población? Pues información sobre medicamentos falsificados, medicamentos subestándar, etcétera. Entonces, esto es como probablemente la población no identifique o no tenga un impacto directo sobre qué es Reliance, pero sí está viendo que la autoridad reguladora hace uso eficiente de sus recursos y entonces enfoca sus esfuerzos en poderles comunicar, en poder vigilar aquellos productos que por riesgo sanitario lo requieren. También a efecto de poder fortalecer el Reliance, se desarrollan alianzas estratégicas con organismos internacionales, incluyendo las autoridades reguladoras, porque como se los dije en un principio, no puedo confiar en lo que no conozco. También en el sector privado, para que poco a poco reconozcan a la autoridad reguladora como la autoridad encargada de vigilar que los productos que están en el mercado sean de seguros, eficaces y de calidad. Hemos gestionado mucha relación con la academia, con las instituciones, tanto públicas y privadas, para que las personas ya de una vez pues salgan con los conocimientos necesarios para poder formar parte de las autoridades reguladoras y conozcan el sentido o el enfoque que nosotros tenemos para poder vigilar, para poder contribuir a la salud pública. Y por supuesto, estamos de la mano con la micro y pequeña empresa para poder orientarles sobre todos los pasos que deben de seguir para llegar a formalizarse y pues contribuir con nosotros también para que puedan tenerse productos de calidad en el mercado. En términos generales, la aplicación de la convergencia regulatoria y también Reliance nos permite lograr esos tres resultados: la eficiencia de los recursos, el acceso a los medicamentos o de los productos en general de forma oportuna y, por supuesto, el desarrollo también económico. De mi parte, nuevamente agradecerles por el espacio. Espero que sigamos promoviendo los aspectos estos de Reliance, de convergencia regulatoria, que son tan importantes para el desarrollo, no solamente farmacéutico, sino también de salud pública en nuestras Américas. Muchísimas gracias y quedo pendiente de las preguntas.
María Teresa, muchísimas gracias por tu presentación. Vamos a continuar entonces con Ana Patricia Pineda de la FDA para al final concluir con las preguntas que ya tenemos varias capturadas tanto en Q&A como en el chat. Patti, bienvenida. Adelante, por favor.
Ok, ¿me escuchas?
Perfectamente bien.
¿Y ves mi presentación?
No todavía.
¿Todavía no?
No.
Ok. A ver si ahora
Eres
sí.
Eres there. Thank you.
Okay, perfect. So we're going to be presenting today. I don't just let me open this because it's doing funny things. Okay. So thank you for inviting me, and thank you for giving me the opportunity to talk a little bit about regulatory convergence and reliance. I know that there's a lot of people that it's a serious attendees to these seminars, and they are going to say, oh my gosh, she's going to talk again about regulatory reliance and convergence. But bear with me. We have a lot of good outcomes today on what we have been working in the Latin America office of the FDA. And also we are going to go through some of the basic of reliance and regulatory convergence for all those that are new to these seminars. So starting with the regulatory reality, sorry about that, it's in Spanish, the headline. So we need to focus on what is our reality, and I'm really happy that I'm speaking after the SRS in El Salvador, because she made very good points of what I'm going to explain. So I guess that she talked everything that I was going to. So this is going to be shorter than I thought. But mainly is us as regulatory agencies, regulatory authorities are critical in the path for a medical product to be accessible in a country. Whether we do our functions in an effective and transparent manner will impact in this access. And not only access to the products, but also at the end of the line, we're going to be impacting public health. So how we can do this? Not a single regulatory authority right now currently in the world is able to do it by themselves. We have complex supply chains. These are global. We have several components on medical devices that comes from different countries. We have different regulations in those countries. The technologies are moving so fast that our regulatory controls and our regulatory frameworks are sometimes struggling to catch up with all those new technologies. So how we can do that? How we manage? One of the tools that we have to manage all those challenges is the regulatory convergence and also the regulatory collaboration as a whole. In regulatory convergence, we expect that it's going to be reducing duplication, as the previous speaker said. How regulatory convergence does that? It does it by creating a common language. We are all going to be talking in the same terms, using the same concepts, and hopefully understanding the same thing. Okay, and that common language also uses common criteria and common standards, meaning international consensus standards. So all this together facilitates the collaboration and the cooperation, the work sharing, eventually down the line reliance. And if we move a little bit further, also perhaps we could have or think about recognition agreements. For regulatory convergence to be successful, there's certain specificities that we need to bear in mind. One is to have a flexible regulatory framework that allow us to rely on another regulator, or at least that allow us to use international standards, that allows us to use other decisions to include that information in our decision-making process. Okay, so this whole regulatory cooperation comes in a stepwise approach. Okay, we can start with information exchange, how we exchange information, how we get to know each other. Again, the previous speaker mentioned several times, I cannot trust that I cannot, or that I don't know. So we start simple. We exchange information. What do we do? How do we do it? Then we can move towards convergence. We participate in the same convergence initiatives. We implement the same technical documents and international standards. We have a nice framework that is aligned with each other. Then we can go and say, okay, we have the same framework. How we do assess that we are doing it or implementing it in the same way. From there, we can move towards work sharing, making joint assessments or joint inspections in sometimes, and implementing reliance mechanisms. And as I mentioned, down the line, we can go to explore recognition agreements that can be unilateral or that can be mutual recognitions. For all this stepwise approach to work, we need feedback throughout the whole process. Every time we receive feedback, we improve. So at every step, we need to be certain that we have enough strong, robust communication channels with each other that allow for a constant feedback for a constant improvement. So, what is it that our office does about this regulatory cooperation? We do several different activities with different countries in all the steps that I just mentioned in regulatory cooperation. For information sharing, we receive a lot of inquiries, both from regulators and stakeholders, on how we decide, how we do our process, how it is our regulatory approval process, where can I find your regulatory framework, how do you develop the guidances. All that is a very common routine activity that we deal with on a day-to-day basis. But we have in the next step in convergence, we have more efforts and more investment in time and resources, so we can improve or we can foster the engagement of the countries in the region to several regulatory convergence initiatives. Specifically for medical devices, I don't know what that moves, sorry about that. Specifically for medical devices, we work with two initiatives. The International Medical Devices Regulators Forum, that is mainly its objective is create technical documents to regulatory control of medical devices that covers from approval, from submissions, adverse events, you name it, clinical trials. It covers the whole life cycle of medical devices in an effort to have harmonized criteria to conduct our regulatory functions in each of the jurisdictions that are part of the IMDRF. As you can see in the slide, in yellow, there are highlighted our affiliate members to the IMDRF. And as you can see, we have several members in the region in Latin America. This affiliate membership was opened last year. It's very new. And in that year, we have accompanied, supported, encouraged our fellow colleagues in the region. And we have so far 8 Latin America countries that are or that join IMDRF as a affiliate member. The other initiative on medical devices that we work with is the Medical Devices Single Audit Program. For this program, they also opened a couple of years ago the affiliate member membership, and in this one, as you can see, we have 2 countries in the region, Mexico and Argentina, that are affiliate members. And we are working with some of our colleagues in the region to increase the number of countries in the Americas to be a part of the MDSAP also. So what does this mean? What is the benefit of having the participation of all of several countries in the Americas? Yes, we have more aligned frameworks. That's great, and that's the main objective of these initiatives. But we have seen that there's a lot of more benefits. When we see the people that attend the meetings, the technical meetings of the IMDRF, for instance, you can see how they have these very open discussions on technical issues. Sometimes they bring up some of the challenges they're facing in an overall way, or perhaps they see some specific case that they want to discuss with another regulator because the products come from that country or because they have having the same problems with a certain product. That space that provides for this close discussion and open, honest, candid communication is one of the most valuable things of these initiatives. This allows for the improvement or strengthening of the expertise, of the technical knowledge of the experts that attend those meetings, that then is trickled down within the agencies. And in the end, it strengthens the whole agency. So that's why we see a real benefit, and that's why we see the value of focusing our efforts in the Office for Latin America in these regulatory convergence initiatives. I promised results at the beginning. And as you can see, we have been progressing. We have been able to work with our colleagues in a constant improvement of the regulatory frameworks in the region. But having talked about the benefits and all the nice things that comes with participating in these initiatives, full disclosure, we have to also talk about the challenges. So what are the challenges that we have seen to actually participate and fully engage in these regulatory initiatives? First, we have this problem and this struggle with the countries between using international versus domestic standards. Some of the countries believe or they see the international standards as something strange, something different that don't apply to their own reality. So they decide that it's better to go and develop their own domestic standards. What happened with that? What's the long-term challenge with creating your own domestic standards? First is you isolate your regulatory framework. Those standards are only applied in the country, so that may hinder the access of innovative therapeutic technologies, which in turn is going to impact in the ability of the patients to get the technologies or the therapeutic tools that could improve their quality of life or their life. So the other downside is that to create domestic standards and to maintain them up to date, we need to invest resources and time. So at the end of the day, as we see it, working in international standards, participating in the development of those standards may use less resources, may also transcribe or translate all our concerns, all of our specificities into these international standards. So at the end of the day, the international standards, that once consensus, it has taken into consideration my concerns and is easily implemented in my country. So the second challenge, international cooperation versus other priorities. And that is something that us, the people that work in international cooperation offices, face every day. Because our regulatory agencies are also dealing with a ton of other activities that are more pressing, that have more visibility when you think about public health. So international cooperation goes to the bottom of the pile. And sometimes it's something that countries don't identify the value of using. But when you use international cooperation, when you participate in regulatory convergence, when you use and implement international standards, the benefit is not going to be the next day. That's for sure. But down the line, you're going to see a more streamlined, more standardized regulatory process. We have seen the examples from Anvisa and from the SRS, where they have shown that at the end of the day, perhaps 1 year, they have seen already good results and good outcomes in resources, in timelines, and in costs. So the third challenge that we have seen is consistent implementation. Again, the agencies sometimes believe or they see that the documents, the international documents, are not fully implementable, if that's a word, in their own country. So what they tend to do is to change it or to add some requirements. But at the end of the day, if you think about all the work that is being done before you publish a consensus technical document, all that work is just laid to waste when I change the document, I alter the document, I adapt the document so it fulfills my needs. What can I do? Again, what you can do is participate during the development so they can hear you. If you saw the different memberships in the IMDRF and MDSAP, even though the countries are not full members, they still can voice their concern. They still can provide their comments. They still can say, okay, you know what? In my country, I am seeing this. And it's completely opposed to what is in the document. How can we work it out so I can implement the document? Okay. That's the value and that's the beauty of participating in these initiatives. And the last one is the active participation in the initiatives. Perhaps it's a case of resources. You don't have enough resources to participate in all the 20 working groups that I would like to participate. Well, in this case, what I can do is work with other countries. We have seen that there's, at least right now, 4 countries in Central America and the Caribbean that are participating in the IMDRF. Why don't we work together? Why don't we split the working groups and then convene and discuss what we have seen each other in the different working groups? And in that way, we can comment and we can participate in more working groups than if I were just going by myself. If it's the language, sometimes problem is language. I am not very comfortable talking in another language during the meetings, but what I can do is take the documents home, review the documents, make comments, and send them by email. In that way, I can surpass the problem with language. In our region, in Latin America, we are very, very creative, and we can do a lot of things with constrained resources. And that what we have seen, at least in our office, is that all these challenges that you've seen in the slides right now, they have been overcome by different regulators in different creative ways. So the key point here is communication. Collaborate and look for common solutions that could help us improve the regulatory control of the medical products. So I saw a question in the Q&A box, and they were asking, how do you assess that the authority where you are relying is good enough, right? So we have seen from ANVISA and the SRS that one way is going and making the assessment of your regulatory framework versus the regulatory framework of the other authority, and see if it's aligned and if the performance allows for the same level of control, for the same level of protection of my population, of the same level of stringent assessment of the medical products that are being assessed. That's one way to do it. There are also other standardized tools that can help. For instance, the World Health Organization developed a global benchmarking tool that serves to assess the regulatory functions of an authority and then classify the authority according to their maturity level. And not only that, it also helps the authority to identify all those areas of opportunity that they could look into to strengthen all the regulatory process. It also identifies the strengths, and the strengths are useful for all those other agencies that are looking to rely on those third regulatory authorities. So they can see, okay, this is strong on inspections, then I can rely on inspections, as the lady from SRS was mentioning. You can go from function by function. If from the GBT, I find that X authority is very good on clinical trials, well then I can rely on the clinical trials assessments. So this is a tool that is very flexible and very interesting when developing reliance mechanisms. Going a little bit further, the WHO moved from only the regulatory functions to assess performance. How is the actual performance of the agency? And those agencies that are found that are highly mature, highly performing authorities are then included in the WHO listed authorities list. So those are also reference authorities that could be selected in pre-qualification programs, in purchase programs, and for the countries, they could also be used as a list indicating who are stringent authorities that I can rely on. A third option in the region is also a regulatory landscape that was conducted by PAHO, where they identify the same thing, what are the strengths and what are the areas of opportunities of selected regulatory authorities in the region. Moving on to the step of reliance, the FDA has a reliance program that is the MDSAP, where we rely on the audits that are conducted by certified auditing organizations that conduct audits to medical devices manufacturers. Okay, if the auditing organization conducts the audit and says this manufacturer is in compliance, then for a surveillance inspection, the FDA is going to take it as good and is going to recognize the outcome of this audit. On the other hand of the reliance, the agency has also increased the information that is public available through our databases. We have several databases for medical devices on the different regulatory process that we have: approval, authorizations, clearance, inspections, that are in different databases. So I'm just, in the interest of time, I guess I'm already talked too much, but in the interest of time, I'm gonna go through some examples of our databases so you can see where you can find information. In the slides, I am including the links, so you can click in the slide and go directly to the database. So there are several ways to access our information. You can go to the product classification database and enter either the type of device, the product code, the regulation number, and that will come back with information. So you can include as a device, I don't know, non-invasive blood pressure, as in the example, and this will come back with the product code, the regulation number, and the device class. Other method is to search in the clearance approval databases. So you can include the number of the 510K notification. You can also do a quick search, and perhaps we can put the same type of device, and it will come back with the number of the 510Ks cleared for that type of device. A third method is look into the device listing database, where you can look for establishment, for owner, for proprietary name, and establishment type. There's several fields that you can fill in there, or you can just go directly to the quick search and look for free text. Here, it's an example of what you're gonna be having from the search, where you can see the regulation number, you can see the device classification number, and very important in the reliance part of the talk is the summary. The summary, when you click to the summary, is gonna open a PDF where it's gonna have the whole identification of the product. Is gonna indicate what is the predicate device. It's gonna have the description, the indications of use. It's gonna also have a table with the comparison with the predicate device, so you can also see what we were assessing when we decided to clear the product. So this is for the databases. I guess that if there's interest, perhaps we can set up a webinar. It would be a nice webinar to go through the whole databases from the different regulators in the region, so we can get acquainted with what is there publicly available. Just to close, we have benefits or outcomes from all the reliance and the regulatory convergence that we have heard from our previous speakers, and basically is the improve of knowledge of all the NRAs that are participating in these mechanisms, is strengthening the regulatory capacity of our authorities. We also promote participation in global initiatives so we can use international standards that streamline the regulatory process. We also see during the COVID-19 emergency that those countries that were participating in global initiatives or that have implemented technical documents that were aligned with international initiatives had a most rapid response to the emergency, because they could easily rely or trust the results of other countries. So this is everything from my end. Thank you so much, and I'm happy to hear your questions.
Patty, thank you very much. Thank you very much for our three speakers. And yes, we do have questions for the three of you. So we will get started with a question posted by Malena Tapia, and this is to Karen. Thanks, Karen. Do you already have a process to manage future changes like package inserts, stability data, etc., in medical devices approved via Reliance pathway?
Hi, Sandra. I was not listening.
Oh.
Can you repeat, please?
Oh, absolutely. My apologies. So this question is coming from Malena Tapia, and her question is, she's thanking you for your presentation, and her question is, do you already have a process to manage future changes like package inserts, stability data, etc., in medical devices approved via Reliance pathway?
No, as I said before, what we are analyzing is we have a resolution and some criteria for labeling, and we are just following what we have in the in our resolution, and what we check is according the label that the company has in other countries. We check if the usability, if the indication and the intended use is the same. This is what we check in the IFU.
Okay, thank you. And if something changes after that approval was granted, like there's additional information on stability data for that particular product, is there a specific action? Is there a specific process for those changes to be communicated and still be in compliance with the Reliance mechanism?
The process is the same. If we have any, because even we receive all the documentation regarding the Reliance, we have to receive all the documents for like as an ordinary assessment. So when the company identifies there is it is necessary to change any information regarding stability or other kind of information, the company has to send this request to Anvisa, and then we will check it with the all documentation, the whole process, to check the information and to evaluate this change. So we check, sure.
Perfect. Thank you very much. We have another question from Andre Gaban. This is a general question for our regulators here. What is the approach that Anvisa, SRS, and US FDA are taking towards to an aligned alternative to reduce of impact of PFAS dependency challenges in our medical devices arena? I don't know, we could probably get started with Patty, if you would like to comment on this.
That's a very good question. And that question, I'm going to bring it back to home because I don't have the specifics, but certainly I can send you the information through email and you can share it to Andre.
Okay, thank you very much. And probably we'll keep it there just to continue with our dynamics because we have several questions here for all of you. So thank you very much. We have from Sergio Madeira. Please, do you have any example of a medical device approved by Anvisa from a Brazilian manufacturer that received FDA approval through Reliance?
To receive what approval?
FDA, US FDA approval through a Reliance mechanism?
I don't have the name here. I can check. And then I will enjoy an answer. I check a question here, and the John Belloy, it's how many of the 37 review have been approved? May I answer this now? And then I
Yes,
enjoy.
please.
Okay, so we have 143 submissions consider Reliance. From this, we have approved 38 was approved. 95 are waiting for analysis. And we had the only one from this Reliance submission was not approved. And we have 9 submissions that we are waiting for some kind of information. So we received 143 since June. And from this, we have 38 approved. So we consider that we could enjoy all this time because we use much less time to analyze these submissions, and it could be more very useful for us in terms of time to release the register.
Thank you, Karen. And probably we can continue with the questions for you from Jocelyn Charel in the chat box. You can, I think you can read it yourself, but for the benefit of the audience, it's a question for Karen. A product class 2 at FDA and after RDC 830 in Brazil is class 3, could not use Reliance. Let's make it more clear. A product got 510K as class 2, but based on RDC 830, it is class 3. Based on that, Reliance mechanism could not be used?
Actually, the company has to prove the regularization in the country. So the company needs a document issued by the health authority saying that product was approved in that country. Like, for example, in the US FDA, it is possible to use the letters for product approval, such as Mrs. Ana Pineda just showed us. So you can search the product, and then you can use that information that you can check in the US FDA website, and you can use this information. So what is important, this statement, like for the product registration has the statement for the product registration has to be issued by the authority, because we receive sometimes the statement issued by the manufacturer saying all the components and saying that the product was registered in the certain authority, so it's not allowed. We ask for the statement issued by the authority. So, and answering the question, yes, maybe the classification for the US FDA is different from the Anvisa, but what we will check is the register is approved in the country. So let me more clear, a product got 518K at class 2, but based in an RGC 830 is class 3, based on the reliance could not be, can be used, can be used. If you have the 510 key, yes, it can be used.
Perfect. Thank you very much, Karen. We have here another question from Sergio Madeira. Do you have any, no, this is something I've already asked, I'm sorry. Next question for Patty Pineda. When you do a registration update, is it possible to see the list of codes registered, the previous one and the ones that were included? If yes, can you teach us how?
Okay. Let me see if I understand it. Okay, so I'm gonna share my screen very quickly, promise.
Please, thank you.
Can you see it?
It is coming.
Open.
We can see it now.
Okay, so this is the registration listing. I guess that's the one that they are referring to.
Yes.
So I'm gonna
exactly.
just put one name in there, the name of the company, and then you can see here all the devices that are listed, and then here in the bottom of all the bullets, you can see show all the 60 or whatever number of listings they have, and then you have like all of them. So I don't know if that's what they are asking, hopefully, but if not, if I don't think that we have time to elaborate a little bit more. But if not, I'm gonna put my email in the chat so they can send me an email and see how we can further discuss this.
Thank you very much, Patty. I think that is going to be very, very helpful. Now we have another question here for Karen, and that is related to whether there's an opportunity for you to share what have been the efficiencies, the regulatory efficiencies that you have identified while implementing Reliance.
For us, we are having like problems for human resource. So even so, I think we have more than one. We have this is the human resources is a very good benefit. Also, we have the time that we release the product in the market for the population. It's also another benefit because you can offer more alternatives, medical device alternatives for the population. So I think this is two very good benefits. And also, I would like to, like Mrs. Ana Pineda said, I think it's a very good idea to talk about the database informations, even not only for Reliance, but I think if it would help if the documents presented to all the authorities had the same structure, and it would be very helpful for the companies. And also when we have any kind of doubt about the documentation, it would be very easier for the companies and also for the authority agencies. I think it would be a good idea.
Perfect, thank you. We have one more question, just to keep our time schedule properly managed. And this is another question for you, Karen. It is, Europe was not included in the Reliance mechanism, in the Reliance regulation for ANVISA. Is there any particular reason for that?
For what? Sorry.
For the European Union approvals that are not included?
No, not specific. No, there is in the beginning, as I said before, we used the MDSAP authorities that we started this relationship with MDSAP, and we participated with all the elaborate all the regulations, and we participate in inspections. And in MGSAP, we have already a relationship, and we have close communication. And I think it was only because of that, but we are open to discuss the possibilities to include more countries. But remember that also this is a very long process. We start with we have to harmonizate all the documentation in the IMGRF, and then we have to make sure that the country use the same documentation and the same criteria that we use. And so I think we can discuss, and just to make sure that all the countries are using the same criteria, the same parameters, the same documentation. And I think in the future, I am sure and I hope we have more countries participating and using the reliance mechanism, because if we use the same criteria, the quality criteria, I think I see it's a benefit for all the countries. And then we can focus in the different technologies like we are having now, and we can keep the technical team in subjects that we need more people and with a fast answer for the question. So I think in the future, for sure, we will have much more countries in the reliance mechanism. And I hope so. This is the idea.
And this is great news. I mean, having the intention will ensure that it will eventually happen. I mean, we all understand it has to reach a certain maturity level in order to continue expanding and growing and strengthening. So really, thank you very much. We have several comments congratulating the three of our presenters today. And Patty Pineda, you just opened up really the opportunity to have this database webinar. We have a comment in here, so we're going to be contacting you so we can coordinate for that.
That's always great. That's always great to have the next one on the line. So yeah, I love it. Thank you.
Absolutely, absolutely. So really, thank you very much, María Teresa. Muchísimas gracias. Un saludo al maestro Noé, por favor, y muchas felicidades también por lo que están logrando. So thank you very much. And with this, we're closing this section of our session today. And last but not least, I would like to invite Marina Carvalho to share with us her experiences in this very last engagement at the World Trade Organization during the celebrations of the 30th anniversary of the Technical Barriers to Trade Agreement. So Marina Carvalho, as you are aware, she's our expert in trade and good regulatory practices at the coalition. She's a corporate and policy professional with 18 plus years of experience in international trade, in advocacy and strategic consulting on issues related to international trade, corporate matters and intellectual property, foreign direct investment, trade remedies, and market access. She served as CEO of the Brazilian Sporting Goods Industry Association between 2014 and 2019, working with senior executives representing and redesigning the institutional positioning of the sporting goods sector in Brazil and engaging on foreign trade, trade remedies, customs, and regulatory law. She's a top-ranked international trade lawyer and has consulted for international organizations since 2018. She is an international trade she's an international trade consultant at the United Nations Development Program, a researcher at the Brazilian Institute for Applied Economic Research, and worked as a senior investment consultant for the World Bank. She's also the director of the NGO Women Inside Trade and WITcast producer and editor. She also participated in the training program at the Brazilian Diplomatic Mission in Geneva in 2008. She has really wonderful academic credentials as well. So Marina, the floor is yours.
Thank you, Sandra. Thank you so much for this introduction. And so I have no presentation for today. Actually, I have more like a conversation and a report of what's going on for the past months in this area of the relation between the coalition and the World Trade Organization. And so I would like to begin by telling that in this year, we've been working with the WTO for the coalition since the beginning of the coalition, trying to improve e-ping system in order for them to have, for example, a more complete list of medical devices and harmonized one in order for companies and countries, when they access e-ping, they get the full experience of in terms of information regarding notifications of technical regulations being published by countries in relation to medical devices. So we've been working with them for quite a few time, and this resulted in a very good partnership. So this year, the WTO invited us to support them in a TBT agreement training that they conduct regionally throughout the world. So this year they did the regional training for Latin America in Rio de Janeiro. And they invited the Inter-American Coalition as the only private sector entity to discuss how we have been working with the TBT agreement, and also the relation between the TBT agreement and the medical device sector. And it was a very interesting opportunity, because being together with the authorities from all Americas and being able to tell them how do we do our work at the coalition in terms of bringing the information on good regulatory practices and also international standards, and how to apply the TBT agreement in our capacity building program was really such a good opportunity. And we also had the chance to present how emergent technologies in the medical device sector is coping with the technical regulations, and how is adapting the system in order to be inserted within technical regulations. We know that sometimes the regulations have to speed up its own processes in order to attend the needs of the industry and the industrialization process of products that have these high-tech technologies that are not regulated still. So it was a very good opportunity to present Reliance and MDSAP and all the effort that the sector has been doing in order to spread the idea of relying on other authorities when they are already advanced in the process of registering products that some other authorities are not yet in that process. And by doing this, we can diminish the line and the backlog of registration of products in different countries, and also bring harmonized registration process in different countries. So this training occurred in October this year, and because of the authorities were so surprised, because they were not regulators only from the medical device sector, so it was regulators from different sectors present in the training, but they were really attracted by the idea of Reliance, and that was also a very good experience and a good practice to share. And that's why the WTO invited the coalition to participate in the event that happened on November 8th, when they were concluding the triennial review of the TBT agreement. And they were celebrating 30 years of the TBT agreement at WTO. So in order to do this celebration, they invited former negotiators of the TBT agreement and also the current negotiators to discuss what was framed when the TBT was raised and negotiated 30 years ago, and how it evolved and how it's being applied nowadays, and how the negotiations evolved. What are they negotiating now? What is the core aspects of negotiation on the TBT agreement? And then they invited the 3 different private sectors to bring this to answer these 2 questions: how the TBT help us, and how the TBT can be improved in the future. So the coalition went to present our work on this, together with wine and spirits sector and apparel sector. And I'm going to bring a little bit of what we presented to the WTO in this event, because somehow it's I think the priorities of the sector when it comes to good regulatory practices and technical regulations, international standards, and conformity assessment procedures. And we see them, the WTO and the TBT meetings, as a very strategic stakeholder right now, because we know there are several odds at the WTO right now, but we also understand that when it comes to the TBT agreement, we might actually get very good results still in the negotiation process, and also with the special trade concerns that countries can bring to the TBT committee in relation to technical regulations that might not be justified, or that might not be relied on international standards. So we presented basically all the work of the coalition, and also we brought some great results that we had within the past years, since 2020, that we've been working with capacity building. And basically, as I said, we were like a replicator of the TBT agreement and the TBT rules, and how to apply them, and how to apply foundational good regulatory practices within the creation of technical regulations by national authorities. So it was very interesting, because I also brought 2 important facts. The first one is that, which is a sad one, the pandemic was a real-time, live, bad experience on how we need products, medical devices, and how difficult can it be to access them if we don't have the regulation as it should be. So this first fact justified a lot of our actions, trying to bring authorities with technical regulations that were internationally aligned, and thus making access to those products more easy and efficient, and in the end of the day, saving lives of patients everywhere. So, and the second fact, which is, I think, a big one that we don't usually see everywhere, is the cost of misalignment. So we assess the cost of misalignment in technical regulations and delays with licensing procedures across the world, and the number amounts to $50 billion in misalignment only. So this is a huge amount, and by doing, for example, the kind of training that we did in more than 60 countries, and training more than 11,000 people in the past 4 years, with much less than that, we saved billions of dollars in misalignment if we follow standards that are if we follow good regulatory practices that are aligned with international rules, international standards. So this is the greatness of the work of the coalition, and that is compliance, and that it shows how the TBT supports us in our job. And in what regards the second question, which is like how the TBT could be improved these days and in the future. So we mentioned first the necessity for countries to keep assessing e-ping and improving their notification process. So we understand that training on how to notify, which kind of information should we include in the e-ping notifications, what kind of details, that should be something that it cannot stop. And it's very interesting because one of the consensus during the TBT event is that the good regulatory practices is getting much more impact and attention during the TBT negotiations. And partially this is because countries are each day more convinced of the need to apply good regulatory practices much in advance of the implementation of the regulation, because this is going to save a lot of work afterwards, and also in the end of the day save money and result in good regulations. So we don't dispute the need of a technical regulation, but we understand this technical regulation must be drafted following these good regulatory practices, and those practices, the earlier they are applied, the best regulation you will have. So many of the negotiations are around good regulatory practices. Last year, the WTO published the guidelines on conformity assessment procedure. That was a major outcomes of the TBT committee, because it brings the main principles and guidelines ratified by the WTO members when it comes to conformity assessment procedures. And we know that there is the same kind of negotiation going on good regulatory practices, to publish a guideline on good regulatory practices. Those negotiations were stuck at some point, and we brought the message asking WTO members to go back to this negotiation process, because we understand that the guideline on conformity assessment procedure is actually a sign that some obstacles were already superseded, and potentially there's now negotiating space for bringing the guideline on GRP into force. So that was something that we brought it. And we also mentioned the need for the WTO to work more in convergence with the WHO and the IMDRF. So it's very important that they send a message also to the international organizations for them to apply GRP and for them to follow those practices, and even the premises of the TBT agreement when they're applying their own rules. We understand that sometimes the international organizations have a difficult and complex way of doing their own proceedings. So by following and having this kind of cooperation, we understand the TBT committee could spread also their impact through other agencies and organizations. And finally, we understand and mention that the benefits of reliance and the benefits of recognizing the other authorities' work on registration of products can be the halfway for emergent technologies to be registered fastly, cost efficiently, and safely, with security for patients. So in this way, we suggested that the TBT committee keep up with benchmarking how regulators that are already applying reliance, that are already looking at emergent technologies, such as the FDA, such as Anvisa that applies reliance, and the other MDSAP authorities, for example, that this is brought as an example to be followed, because that's the way we understand that probably technologies are much faster than regulations. So if we want to be a little bit in the same pace as new technologies, we should really be strong on relying on how authorities are already taking care of this. So it was a very important event to bring this kind of discussions. There was a very urgent motion to bigger participation of the private sector within the TBT committee meetings. So I think it's also a work of the coalition and other stakeholders to bring those informations and those inputs to the WTO and to the TBT committee in order for them to rely more on us, and also for us to be able to understand how and what are they negotiating that could impact us further in the regulatory process. So in a nutshell, Sandra, that was the update that we have. I think we might have space for improving capacity building in partnership with the WTO, especially to bring more space on how to apply the TBT agreement by authorities. Unfortunately, it was understood and affirmed there that many countries still don't know how to apply this agreement. So it's part of our job to also bring this kind of information to the authorities that we work with. And I would like to thank you for the opportunity also to being able to represent the coalition at this event. It was very important, and I think it was a very, very good opportunity for the coalition to present the work that we've been doing through Americas and Africa in the past years.
Marina, really, really thank you very much. And I think that, it is great that there is this openness for these conversations, and for these conversations to happen up there in Geneva, celebrating the 30 years, and for us to have witnessed that through the openness of national regulatory authorities, through developing a better understanding on the benefits coming out of proper implementation of good regulatory practices. And I'm bringing these words from Manuel in his initial presentation. It is not only a matter of implementing good regulatory practices, it is a matter of implementing them in the correct way. And I think, just as you mentioned, I totally agree. I think that when we start speaking about good regulatory practices now, surprise is not as frequent as it used to be only 5 years ago, at least in our sector, when we started our work in this area. And I think that we are here because of, again, the commitment, the sensibility, the understanding of all relevant stakeholders on the benefits that at the end of the day, patients are going to get because of proper implementation of good regulatory practices, proper implementation of convergence, proper implementation of reliance mechanisms that, again, at the end of the day, are going to be benefiting governments because of a better use of our resources, a more efficient utilization of their resources that will, for sure, end up benefiting in a broader way to the population that we're all committed to serve. So I do not see any specific question for you, except for a comment from Andre Gavan. An honor to work close with Marina. She's so proficient and professional on TBT questions, always educated by her insights. And we also have a comment from Sergio Madeira. Excellent, Marina. And I really joined them in congratulating you with all the efforts and all the knowledge that you share. And really, just a reminder for all the attendees to this session, we are open. Marina is always open to help you while working in these working groups, these opportunities to collaborate with national regulatory authorities while developing or updating regulations to make sure that the process is in compliance with good regulatory practices. We are also here to help when commenting on draft regulations as they have been published, on commenting and contributing to strong regulatory impact assessments as they're an integral part of good regulatory practices. So you count on us as a coalition to help you in these processes. And we are here. We are all at the reach of an email a phone call, a WhatsApp message, so we can, again, contribute with all your efforts. You have seen the network of experts that are always available and willing to support our efforts, and not only supporting them, providing ideas to have them continuing to support the efforts on capacity building of all of our members. So with this, I'd really like to thank all of you for joining us today. For the coalition members, remember, we have a date for tomorrow where we're going to be discussing the progress of the coalition, the working groups of the coalition, and our plans for 2025. So thank you very much. Enjoy the rest of your day. And of course, if you have any questions, comments, feedback, please just reach out to us and we will be glad to continue our discussions. Thank you very much. See you tomorrow.